So we are continuing with the Quinolones drugs. How the Quinolones drugs are formed. These Quinolones drugs are synthetic derivatives. These Quinolones are synthetic antimicrobial drugs, and which is very much effective against the Quinolones drugs are active against the gram negative as well as the gram positive bacteria. These quinolones are very much effective, and nowadays the quinolones drugs, or nowadays comes under the name of fluoroquinolones. These drugs are very much effective, and it is used broadly in today's condition, because it is very much active against the gram negative as well as the gram positive bacteria. So first of all, we will see the structure of quinolones drugs. This is the structure of quinolones drugs. First of all, these drugs were developed in earlier days against the gram negative bacteria, but resistant had developed. As this is the structure of quinolone molecules, as the resistant has developed, then against the development occurs in quinolone groups by attaching fluorine group at 6th position. By attaching the fluorine group at the 6th position in this quinolone structure, and piperazine molecule at the 7th position. It were the quinolone molecules, and at the 6th position the fluorine molecule is attached, and in the 7th position it is the piperazine molecule attached. Thus a newer quinolone derived, and these new drug derived called fluoroquinones groups. This is the fluoroquinolone. Why the name fluoroquinol? Because that the 6th position of the quinolone molecule, the fluorine is attached, and at the 7th position piperazine is attached. The new derived is called fluoroquinones, and these fluoroquinones drugs have high potency, very high potency, as well as slow developing resistant. Various quinolones were developed that developed resistant easily, but these fluoroquinones groups, they having slow developing resistance against the bacteria, as well as these drugs are broad spectrum antibiotic and having better tissue penetration. It means that these drugs have good penetration and as well as good tolerability also. Under the classification, that these drugs come under two classification: the first generation drugs and the second generation drug. The first generation drugs, it is the norfloxacin, which is commonly used, ofloxacin, and then ciprofloxacin and pafloxacin. This is the first generation drug. In the second generation drugs, we have got levofloxacin, moxifloxacin, sparfloxacin, and gemifloxacin, lomefloxacin, and pyrrolifloxacin. Thus, the two generation drug, first generation include norfloxacin, ofloxacin, and ciprofloxacin and pafloxacin. Along with second generation, we have got levofloxacin, moxifloxacin, sparfloxacin, gemifloxacin, lomefloxacin, pyrrolifloxacin, as well as gatifloxacin. So these drugs comes under the fluoroquinones and very much effective, nowadays frequently used. Now the mechanism of action of the fluoroquinones. The fluoroquinones inhibits the drugs or inhibits the DNA gyrase enzyme. It is the bacterial DNA gyrase. So we should always remember the fluoroquinol drugs inhibit bacterial DNA gyrase. What this bacterial DNA gyrase does? When it is shown in the figure, it is the DNA molecules. DNA molecules From one DNA, there is replication and transcription occur to form daughter DNA. And again, from one DNA to another daughter DNA is synthesized. So for the replication and transcription, the DNA should be cut or nick, है ना? Nick or it should be cut. DNA should be cutted down. This cutting factor is done by the DNA gyrase, and when the DNA gyrase cuts this DNA, the daughter DNA will be synthesized, and the daughter DNA, then again daughter DNA, again daughter DNA, and the bacteria multiply in this way. So the bacterial DNA gyrase nicks the DNA or cuts the DNA molecules. How it happens? The bacterial DNA gyrase consists of two subunits, the subunits A and subunits B. The A subunits is responsible for nicking of the DNA or the cutting of the DNA. This bacterial DNA gyrase consists two parts, A and B subunits. The A subunits is responsible for nicking or cutting the DNA. In meanwhile, as soon as the A subunit nicks the DNA, the beta subunit is responsible for negative supercoiling. This negative supercoiling means it opens the DNA. It starts open. This is the negative supercoiling. But as soon as the negative supercoiling occurs, the A subunit reseal the DNA. A subunit reseal the DNA. And why the resealing is done? Resealing is necessary to prevent the supercoiling or prevent the positive supercoiling. This DNA is cut down and negative supercoiling is being done. And if negative supercoiling is continue, then there will be a positive supercoiling will occur. So the function of A subunit is the cutting as well as the resealing of the DNA. So then the resealing and the cutting is the both together caused by the A subunits, whereas beta subunit is responsible for the negative supercoiling. And then how these fluoroquinolones acts? These fluoroquinolones acts by binding the A subunits. This quinolone binds the A subunits and inhibits binds the A subunits. As soon as it binds the subunit and inhibits the A subunits, the further sequencing, that is the nicking of the DNA as well as the resealing, which is done by the A subunit. As the fluoroquinolone drugs inhibits and binds the A subunits, the further the nicking of the DNA as well as resealing is being inhibited. Thus, we say the mechanism of action in one line. We can say the fluoroquinolone drugs inhibits bacterial DNA gyrase. Fluoroquinolone inhibits bacterial DNA gyrase enzyme. One another mechanism is in gram-positive bacteria. Gram-positive bacteria constitute of enzyme topoisomerase 4. In the gram-positive bacteria, topoisomerase 4 enzyme is present. This enzyme in gram-positive is responsible for nicking and separation, that is the negative supercoiling of the daughter DNA after DNA replication. These fluoroquinolones thus interferes and inhibits this topoisomerase 4 enzyme. Thus, in gram-negative, it will inhibits the bacterial DNA gyrase. In DNA gyrase, which subunit? It is the A subunit which will be inhibited. In gram-positive, the fluoroquinolone will inhibit topoisomerase 4 enzyme. Thus, the DNA replication and resealing is being inhibited. Thus, the fluoroquinolone inhibits the bacterial DNA gyrase. Now, as soon as the bacterial DNA gyrase is being inhibited, the further sequencing of the replication and transcription is being inhibited. As soon as the replication and transcription, no new daughter DNA synthesized and bacteria is being killed. Thus, this is the very much effective. Quinolones groups are Quinolones groups are broad spectrum drugs. What happens in mammals tissue, in mammalian cell, instead of DNA, as we have discussed, instead of DNA gyrase and topoisomerase 4, in mammalian cells it contains topoisomerase 2, topoisomerase enzyme 2. In the bacteria, it was the topoisomerase 4 and bacterial DNA gyrase. In mammalian cells, contain topoisomerase 2, which is responsible for DNA replication. So, as the fluoroquinolones is active against the topoisomerase 4 and the bacterial DNA gyrase, but very much less effect, and having low affinity with the topoisomerase. So as it has got low affinity with the topoisomerase 2, which is responsible in mammalian cells DNA replication, so there will be low toxicity to the host cells. Thus fluoroquinolone having high toxicity to the bacterial cells because it inhibits bacterial DNA gyrase and topoisomerase 4 enzyme. While in mammalian cells it constitutes topoisomerase 2. It is very important in your PG examination. It is asked that fluoroquinolones will be inhibits topoisomerase 2, 4 or whatever. Then fluoroquinolone will inhibit or act against the topoisomerase 4 and the bacterial, not against the 2, because 2 is present in the host cell, that is the human cells. Now the ciprofloxacin drugs. The ciprofloxacin is the prototype drugs. Ciprofloxacin is the prototype. The first drugs, it is the comes under the ciprofloxacin, and other drugs as I have discussed, the ciprofloxacin, levofloxacin, ofloxacin, pefloxacin, and the second generation drugs. But we are discussing about the ciprofloxacin because this is the prototypes of drug. The ciprofloxacin constitute, it is the broad spectrum and very much active against the gram negative, also active against the gram positive, but very much active against the gram negative, and it is having bactericidal activity, and high potency. This ciprofloxacin has high potency and active against the many beta-lactam as well as aminoglycoside resistant bacteria. These drugs are very much, ciprofloxacin is very much active against the many beta-lactam and aminoglycosides resistant bacteria. The pharmacokinetics. In the pharmacokinetics, it is taken orally, that's it is orally active, and as the stomach constitutes food particles, the food delay the absorption. of ciprofloxacin. It should be noted. As soon as the drug is absorbed, it has got good tissue penetration. It gets highly concentrated in the lungs and in the sputum. It is excreted by the kidney via the glomerular filtration as well as the tubular secretion. Thus, excretion occur by the kidney via the glomerular filtration as well as tubular secretion. Its uses. The uses of the fluoroquinolones groups and the ciprofloxacin drugs. The drugs, it is used in urinary tract infection. It is the urinary tract infection along with in typhoid, the ciprofloxacin. Ciprofloxacin is the first choice of drug. But nowadays ciftriaxone, it is the first line of drug, or the first drug is ciftriaxone. So whenever it is asked in the question, which is the first line of drug or the first drug of choice, should be the ciftriaxone. Also the ciprofloxacin also is the orally first choice of drug. These drugs, ciprofloxacin is very much active against the gonorrhea, chancroids, bacterial gastroenteritis, that is if there is enterocolitis or colitis infection, these ciprofloxacin or the norfloxacin. We use the norfloxacin along with the tinidazole, which comes under the name of Norflox TZ. Thus, if there is gastroenteritis, it means there is colitis, then we use norfloxacin along with tinidazole. We can use ciprofloxacin along with tinidazole or ciprofloxacin with metronidazole. Thus, it is very much active against the bacterial gastroenteritis. It is also effective against the bone and soft tissue bacterial infection, as well in the gynecological wound infection. In respiratory tract infection, the useful drug is the levofloxacin. In respiratory tract infection, these levofloxacin or the fluoroquinolones, it is also used as the second line of drug in tuberculosis. It is used in the second line drug, not first line in the tuberculosis. In tuberculosis, the fluoroquinolone drugs, it is used in under second line drug. And the most common drug we will use in the tuberculosis, the levofloxacin or the moxifloxacin. Other uses is the ciprofloxacin or the fluoroquinolone drugs is the meningitis. In conjunctivitis, we use moxifloxacin. The moxifloxacin in conjunctivitis, we can use the drug moxifloxacin. The adverse effect is the nausea, vomiting, and hypersensitivity reaction. Thus, in this way, our three topics or the three drugs constitute sulfonamides, cotrimoxazole, and fluoroquinolones are being covered up. In further classes, we will discussing more and more. So we must remember about the classification of the various drugs. The important one is the classification, as we have discussed: norfloxacin, ofloxacin, ciprofloxacin. The second is levofloxacin, moxifloxacin, sparfloxacin. So these drugs should be remembered because it will be used in various disease condition and it is regularly used. So the question some questions are being asked. The fluorine molecule is attached at the 6th position and the piperazine is attached at the 7th position. It is in the shown, and then the new derived, it is the fluoroquinolones. Another question as well we discussed about that, why the fluoroquinolone is active in the human cells, not active against the human cells, because it has been low affinity with the topoisomerism 2. This is the mechanism of action. So we will continue our classes. Thank you.